Jason Nguyen, upper airway obstruction. An 8-month-old infant is brought to the emergency department with a 2-day history of difficulty breathing that has progressively worsened. The infant also has hoarseness and an occasional barking cough. Let's go see this patient. His eyes are open, so we don't need to tap and shout, but let's look for breathing. And let's check a brachial pulse. And we want to ask about allergies, so select medical history. Does he have any known allergies? Go to your breathing tab, put on the pulse oximeter. Let's just do some supplementary oxygen. So we'll put a non-rebreather on, and we'll take our flow to 15. Select warm and humidify it. Go to your circulation tab, apply a blood pressure, set up an automatic non-invasive blood pressure so that it cycles every 2 minutes. ECG, attach the 3 leads. So on your monitor, you can see he's tachycardic at 180. His sats are 93. His blood pressure is 78/55, and he's breathing 40 breaths per minute. Let's auscultate. Click on his lung once. They'll listen to both sides. Let's click on his heart. Let's check his cap refill. All right, so he has upper airway noisy breathing. I want to do a racemic epinephrine neb to help with the swelling. So I'm going to go to Drugs and Manage IVIO, use the length-based tape to get his weight. Then we're going to go to Administer Drugs and Fluids, do your respiratory drop down, scroll to the bottom and you'll see racemic epinephrine. Go to your Broslow tape, you can see his dose is 0.25 mils. So select dose, 0.25, start nebulizing. He also needs some steroids, so we're going to do dexamethasone. We're going to give it orally, so through the elixir. And his dose for, as you can see up here, croup, upper airway, is 4 milligrams. So we're going to type in 4.0 milligrams, and we're going to administer his steroids. All right, so we have a neb infusing. We're going to go ahead to miscellaneous. We're going to sit him up. If there was any tests and diagnostics that you would want, you could select those here. Because he's kind of got upper airway and croup, I'm not going to upset him by sticking him for any labs right now. Underneath examination and vital signs, let's get some more of our exam done. So let's go to the vital sign call out. Let's grab a temperature. Let's push around on his abdomen to see what his liver feels like. We can look at his eyes. So under examining eyes, test pupils, we can just hover over his pupils, make sure they're equal and reactive. And they are. And then because the neb will take 5 minutes to get in, we can use this fast forward function. It's the button that's right underneath the picture of the baby. If you'll select fast forward, it's going to go for about a minute. And then we're going to select the fast forward one more time. Sounds better. My breathing sounds better for my baby. Sats look good. So when his neb gets done, which it is done now, I'm going to go and wean his oxygen. So I'm going to go back to my breathing tab, put him on a nasal cannula. I'm going to take the flow down to like 2 to 3. So his heart rate's still a little tachycardic, but his breathing sounds better. Sats are 99. We've weaned his oxygen. His blood pressure is 77/54. His respiratory rate is 24. Let's listen to him one more time since our neb is done. Anytime you do an intervention, we'll reassess. All right, let's transfer our patient. All right, we're on our debriefing page. So here's where you would have seen, if you didn't know what your diagnosis was, you have upper airway obstruction. This is a link that if you select this upper airway obstruction, it will take you to your ebook and you can read about your upper airway obstruction. All the blue words throughout your debriefing are hyperlinks into your book, so you could read about any of these things that you needed. As you read through your debriefing, you have a scroll bar. You're going to scroll all the way through reading your debriefing. When you get to the bottom, you can see that you have your information about how to manage respiratory distress and failure. So if you clicked on these blue words, it would take you to that portion of your ebook as well. We can see here whether we passed or failed, and then we would select continue to move on to the next portion of the modules.